Hello, my name is Casey McLean, and I am a neurologist located at JPS Hospital in their neurology clinic, which is in Fort Worth. I specialize in Parkinson's disease, which is most common among the elderly population. Therefore, I work often with geriatrics. I am so passionate about ridding this population of Parkinson's because over 50,000 Americans are diagnosed with it each year. I wish to improve the lives of these people. There is currently no known cause of Parkinson's, but I plan to be a part of discovering it. Parkinson's is a disease of the central nervous system, which includes symptoms such as hand tremors, loss of balance, slow movement, and shuffling footsteps. Not only is the cause unknown for Parkinson's, but there is also currently no known cure. Luckily, there are treatment options that can help make Parkinson's manageable. No case is the same, so treatment options vary. Parkinson's is related to the dropping of dopamine levels, so I often prescribe my patients medications which increase dopamine production. Depending on the case, I may also prescribe antidepressants, since this is a mental health issue and depression is somewhat common with this disease. I also may prescribe various medications to help minimize tremors. Various light exercises will help to promote balance and movement. It is best to begin exercises as soon as possible. Studies show that the earlier exercises begin, the better. If the disease is progressing quickly, treatment and medications may be more aggressive. I see an average of 550 patients, and roughly 200 of them suffer from this disease. I would like to inform you of one of my patients who is a Caucasian 78-year-old male, who will remain nameless. This patient is a middle-class citizen who lives alone in a very rural area. This patient has Bell's palsy. He had a minor stroke at one point and still shows some signs of aphasia. He underwent a tissue plasminogen activator, which allowed him to have a successful recovery. Overall, he was in very good health before being diagnosed with Parkinson's. Luckily, he was diagnosed in the disease's early stage. I prescribed him levodopa, which is the most common medication in treating Parkinson's. It is a dopamine enhancer. I also prescribed him antidepressants to minimize the anxiety and paranoia he had acquired by living alone. This patient was very fortunate because he was visited by home health physical therapy once a week to work on simple exercises. This patient is a prime example of how well this disease can be managed with proper treatment before the disease gets progressively worse. Although there is no known cause of Parkinson's, some research has shown that living a healthy lifestyle and by eating right and exercising may correlate with Parkinson's. Regardless, living a healthy lifestyle is a positive decision and should be encouraged. It is important upon giving the patient their diagnosis to maintain a positive attitude. It can be scary to learn you have a disease, but many people live happily for years who have Parkinson's. The major problem with Parkinson's is that there is no known cure. This is discouraging news, but research is constantly being done, and I hope that someday the world will be free of Parkinson's disease. Thank you.